Hello and welcome to a webinar about FIV and FeLV in cats at shelters and beyond. My name is Shani and I am with the Humane Society of Sedona. In this training we will discuss the current research and science in regards to FIV and FeLV, dismantle some myths, and hopefully help save the lives of cats across all facets of life. We will specifically discuss cats with FIV and FeLV in our shelter and how we handle their care and eventual adoption. First, let's discuss the difference between FIV and FeLV. FIV, or feline immune deficiency virus, is a retrovirus. It infects the cells of a cat's immune system and can kill, damage, or affect the cell's normal functions. In short, it can compromise the immune system. FIV only affects cats and cannot be spread to humans or other animals. FeLV, or feline leukemia virus, is also a retrovirus but is in a different subfamily than FIV, which means it is a cancer-causing virus, or in other words, it can cause tumor growth. Just like FIV, FeLV only affects cats and cannot be spread to humans or other animals. FeLV can have a more severe prognosis than FIV. So FIV and FeLV are both retroviruses, though they have different subfamilies. Neither virus is very hardy outside in the environment, meaning it doesn't survive outside the cat's body for very long. Both viruses are feline specific and cannot be transmitted to humans or dogs. It only has about a 3% prevalence in all cats, so not very common at all. Let's talk about how FIV is transmitted. Cats will shed the virus in their saliva, and FIV is mainly spread through deep, penetrating bite wounds to another cat. FIV typically does not spread through cats grooming each other, sharing food and water bowls, or sharing a litter box. So let's say the virus is transmitted via a deep, penetrating bite wound. There is the asymptomatic phase. After the initial infection, the cat may not show any symptoms of FIV-related illness for many years. They can live normal lifespans. However, the infected cat's immune system may become gradually more compromised, which leads to the third stage. The third stage is potential clinical phase. If a cat's immune system is compromised enough by FIV, they could experience consequences of immune deficiency. These include chronic inflammatory conditions like stomatitis, inflammation of the mouth, and secondary opportunistic infections like fever, anemia, dental disease, wounds that won't heal, kidney disease, or certain cancers. These secondary infections can be treated as they appear. But also note that cats who are infected with FIV can remain in the asymptomatic phase for life. How is FeLV transmitted? A cat with FeLV sheds a large quantity of the virus in their saliva, as well as in other bodily fluids such as nasal secretions, urine, and feces. However, FeLV is not a highly contagious virus, and transmission generally requires a prolonged period of close contact between infected and susceptible cats. Most cats will be infected with FeLV from their mothers from nursing, but it can also be transmitted through bite wounds. Abortive infection. The cat may experience a transient viral infection, fight off the virus, and develop future immunity. Kittens younger than 16 weeks old are much less likely to fight off FeLV than adult cats. Yet, exposure to the feline leukemia virus doesn't have to be a death sentence. About 70% of cats who encounter the virus are able to resist infection or eliminate the virus on their own. Regressive infection. Cats who become persistently infected do not always develop disease as a result. Some cats produce an effective immune response to the virus while continuing to harbor the virus in their bodies. This results in a regressive or carrier state, an FeLV infected cat who has low risk of developing FeLV-related diseases. The regressive phase of FeLV infection seems to be temporary for most cats. They can actually become free of the virus within a few years. Cats in the regressive infection state are unlikely to shed or spread FeLV. but regressive infection can sometimes lead to progressive infection with an inciting cause. Progressive infection. If the initial FeLV infection is not overcome, the virus replicates and the kitten or cat becomes persistently infected. The virus eventually moves to the bone marrow and compromises the immune system. Although a cat in this state may show no signs of illness for several years, FeLV-related diseases such as anemia, skin diseases, or leukemia typically develop within 2 to 3 years. Cats with progressive FeLV infection shed the virus in their body secretions, including saliva, and can infect other cats. Now, all of this sounds really scary, especially for cat lovers and guardians, but I want to remind you that, again, 70% of cats who encounter this virus are able to resist infection or eliminate the virus on their own. So can FIV be transferred from our clothes or hands? This is going to be especially important for shelter environments or other areas where there's more than one cat, and the answer is absolutely not. FIV is only transmitted through deep, penetrating bites from an infected cat to another cat. FIV cannot survive outside of a cat's body in normal environments for more than a few hours. The virus is easily destroyed with soap and water, so there is no risk being around an FIV positive cat and an FIV negative cat. What about FeLV? Can it be transferred from our clothes or hands? FeLV does not survive long outside a cat's body, probably less than a few hours under normal household conditions. A cat with FeLV sheds a large quantity of the virus in their saliva and bodily fluids. However, FeLV is not a highly contagious virus, and transmission generally requires a prolonged period of close contact between infected and susceptible cats. Washing your hands will kill the virus, and washing your hands between cats should be common practice in all shelters anyways. Can FIV be transferred through casual contact amongst cats? No. Casual contact will not transmit the virus. Even further, close contact, such as cats sharing the same food or water bowls, cats grooming each other, or playing with each other, will not spread FIV. FIV positive cats can live with FIV negative cats as long as they get along. FIV is mainly transferred through tomcats who are unneutered, live outside, and cause deep penetrating bite wounds. Likewise, if you have a cat who is FIV positive, they can transmit the disease to another cat through a deep penetrating bite wound. So you need to make sure that the cats do get along. So can FeLV be transferred through casual contact amongst cats? No, but some precautions are needed. FeLV is spread primarily through cat saliva. It can also spread through blood, tears, feces, and urine. Most cats get the virus from their infected mothers at birth or through prolonged direct contact with FeLV positive cats, such as mutual grooming. FeLV also spreads through bite wounds, such as those caused by male cats fighting. In rare instances, FeLV can be spread through the shared use of litter boxes or feeding dishes. The FeLV virus cannot survive for very long in the environment, so cats that do not have close contact or just casual contact with an infected cat are unlikely to be exposed to this virus. The virus is easily killed by common disinfectants and can't survive in a dry environment. And just to be safe, we should be washing our hands after every cat, FeLV or not. If a cat is infected with FIV and their immune system is not able to abort the virus, some clinical signs of FIV are loss of appetite, weight loss, poor coat condition, persistent fever, inflammation of the gums and mouth, skin, urinary, intestinal, or upper respiratory tract infections, persistent diarrhea, seizures, behavior changes, and other neurological disorders. Also, a variety of eye conditions. But please remember that a cat with FIV may not show any signs of sickness for their entire life. If a cat is infected with FeLV and their immune system is unable to abort the infection, or if they move past the regressive infection, some clinical signs of FeLV are loss of appetite, weight loss, poor coat condition, persistent fever, inflammation of the gums and mouth, skin, urinary, and upper respiratory tract infections, persistent diarrhea, seizures, behavior changes, and other neurological disorders, a variety of eye conditions. But it is important to note that many of these symptoms may not be related to FeLV at all. And of course, the more severe conditions include leukemia and lymphoma. FIV vaccines and testing. It is important to know that the one existing FIV vaccine was discontinued in the United States and Canada in 2015 because it is ineffective and notorious for causing false positives on FIV tests. That is because a cat who has received the vaccine will test positive for the virus. Current FIV tests cannot distinguish between cats who are infected with FIV, cats who were at one point vaccinated against FIV, or cats who are both infected and vaccinated. Antibodies the vaccine produces can persist for more than 7 years in some cats. So in other words, you cannot tell the difference between a cat who actually has the virus versus one who got the vaccine. Standard tests only detect antibodies against the virus, not the virus itself. The presence of antibodies does not mean the cat is infected with FIV. Positive FIV tests in kittens under 6 months of age should not be interpreted as FIV infection. Kittens are rarely infected with FIV, but may test positive because FIV antibodies can be passed to them from infected mothers through nursing. For more accurate interpretation, kittens under 6 months of age who test positive for FIV should be retested when they are between 8 and 12 months of age when maternal antibodies have declined. Even without exposure to the FIV vaccine, FIV tests are not 100% accurate and can yield false positive results. Many cat advocates are urging shelters to not test for FIV. The probability of a false positive are high, and even if a cat does test positive, they can still fight the infection on their own. And if they do test positive, FIV is no longer a death sentence. FeLV vaccines and testing. A relatively effective vaccine against FeLV is available, although it will not protect 100% of cats vaccinated as it is not considered a core vaccine. A positive FeLV test in a cat is not necessarily a diagnosis. A cat in the initial stage of FeLV infection may test negative for FeLV even if they are infected. A cat exposed to FeLV may test positive during the transient phase of the infection and then test negative if the virus is overcome. Overall, results can be shaky and difficult to trust. Many times, further testing is needed. An FeLV positive test does not require euthanasia unless the cat is already ill and suffering beyond treatment. For a more accurate interpretation, kittens under 6 months of age who test positive for FeLV should be retested when they are between 8 and 12 months of age, when maternal antibodies have declined. In general, FeLV tests are not 100% accurate and can yield false positive results. Every cat who tests positive should be retested after 30 or more days. We wanted to share 2 instances where tests were unreliable. First, Lily and Lilac. Last year, we got 2 cats surrendered to us, Lily and Lilac. We were told they were FIV positive, but when their guardian was dropping them off, she mentioned leukemia. We asked her to call her vet and confirm their diagnosis, which she did. One of the cats tested positive for FeLV, and it was assumed by her vet that they now both had FeLV. After having them for about a month, we tested them again, and both came back negative for FeLV. Some shelters will immediately euthanize any cat who comes in and tests positive for FeLV. If Lily and Lilac had received that false positive at a high-volume shelter and not at their vet's office, they likely would have been euthanized when in fact they both did not have FeLV. Next we have Mr. Mr. came from another shelter and was listed as FeLV positive. After having him for several weeks, we tested him again and he was not FeLV positive, but actually was FIV positive. That could have been a clerical error or a simple typo, but again, that false positive could have cost him his life at other shelters. Likewise, some shelters will immediately euthanize any cat who tests positive for FIV. This is why many nonprofits and cat advocate groups are calling for shelters to discontinue testing of cats, as in many cases it results in their unfortunate death. FIV Prognosis and Treatment. Although there is no cure for FIV, supportive care can improve the quality of life, health, and longevity for cats with FIV. But cats who are FIV positive can live full, wonderful lives. An infected cat may live free of FIV-related symptoms for their entire lifetime. An infected cat may live free of FIV-related symptoms for their entire lifetime. Any secondary infections can be treated as they occur. Being vigilant if any illness appears is important. Keeping them indoors, providing a proper diet, and minimizing stress is your best bet. FeLV Prognosis and Treatment. There is no known cure for FeLV, but cats who are FeLV positive can live happy lives. About 70% of cats who encounter the virus are able to resist infection or eliminate the virus on their own. An infected cat may live free of FeLV-related diseases for their entire lifetime. Any secondary infections and diseases can be treated as they occur. Again, being vigilant if any illness appears is important. Keeping them indoors, providing a proper diet, and minimizing stress is your best bet. FIV in shelters. Some shelters will euthanize FIV-positive cats. More and more cat protection organizations have urged shelters to not test for FIV, as the tests are unreliable and FIV is no longer a huge medical issue. We at the Humane Society of Sedona do not euthanize FIV-positive cats in our shelter unless they are clearly suffering and cannot be medically treated. We only test high-risk cats like tomcats who look rough or have been in some fights, or if a cat comes in showing symptoms of unexplained illness. We do have an FIV program here, so FIV-positive cats are safe and welcome. We do keep FIV-positive cats separate from FIV-negative cats unless everyone gets along and they are supervised, but we never leave them together overnight. We have an FIV-specific room just for our special FIV-positive cats. Because FIV is only transmittable through deep, penetrating bite wounds, no extra caution needs to be done beyond the usual washing of hands between cats, and again, of course, you need to make sure the cats do get along. FeLV in shelters. Some shelters will euthanize FeLV-positive cats. More and more cat protection organizations have urged shelters to not test for FeLV if no symptoms are present, as the tests are unreliable, and guardians can get a test after adoption if they wish. We at the Humane Society of Sedona do not euthanize FeLV-positive cats in our shelter unless they are clearly suffering and cannot be medically treated. FeLV-positive cats are safe and welcome here. We do keep FeLV-positive cats separate from all other cats just to be extra safe. Because FeLV is not a hardy virus and does not live long outside the cat, no extra caution needs to be done beyond the usual washing of hands between cats. We have FeLV-positive cats socialized last as an extra precaution. In conclusion, FIV and FeLV are not as common as once thought, and it doesn't have to be a death sentence. Cats who are FIV or FeLV positive deserve a chance at a wonderful life. They are extremely adoptable and can live full lives when extra precautions are taken. FIV and FeLV tests are highly unreliable and false positives are common. It's up to the adopters to decide whether they wish to test their cat for FIV or FeLV. Cats can test positive for the viruses, but may be able to fight off the virus on their own or remain asymptomatic. While the FIV vaccine is highly discouraged and discontinued in some places because it is not effective and can cause false positive tests, the FeLV vaccine is recommended for high-risk cats. But remember, the FeLV vaccine is not 100% effective. Vaccines need to be decided by the cat's guardian. Shelters are beginning to change their FIV and FeLV protocols based on the latest research. Education is key and can save many lives. We have taken the stance that FIV and FeLV cats can be extremely adoptable and deserve a chance. We also realize that we are in a very special and unique situation here at the Humane Society of Sedona. Other high intake shelters unfortunately don't have the luxury, and we are not here to demonize shelters who choose to euthanize FIV and FeLV cats, but instead begin to shift the narrative and perspective on these special kitties. We have adopted out a few FIV and FeLV positive cats, and we are always very transparent to potential adopters. We encourage you to reach out to your local shelter and rescues to find out how you can help these cats, whether it be by fostering, community outreach, and/or education, or perhaps other needs the shelter or rescue may have. Here is a list of resources and also some of the websites where we gathered most of our information from. We encourage you to do more research on your own, as there are many varying opinions out there regarding FIV and FeLV. Thank you for watching this and caring about cats who are FIV and/or FeLV positive. Together, we can help save the lives of these wonderful cats and provide them with an opportunity to live happily in a loving home. Please contact us if you have any questions.